Talking about the anterior aspect of the wrist and the palmar aspect of the hand, it is very important to talk about their function. And the most of the important function of the hand and wrist are involved in prehensile functions and the grips and all of things of that sort. And that actually is responsible because of the muscular actions. So it is very important to understand the muscles. But in addition to the muscles of the hand, there are muscles coming from the forearm as well, which act at the hand and the wrist and are very integral in the functions performed by the wrist and hand. And these muscles are known as the extrinsic muscles of the hand and wrist. So these extrinsic muscles are actually divided in numerous layers. So these are the superficial layer, intermediate layer, and deep layer. So these muscles may be originating from the forearm, and they may be present most of their we can say the bulk and their bellies may be present in the forearm, but their functions are at the level of the wrist and hand. So that is very important when considering and discussing the palmar aspect of the hand and the anterior or the ventral aspect of the wrist. So muscles on the anterior aspect of the wrist, which are in terms of the extrinsic muscles, they include three layers: the superficial, intermediate, and deep layers of extrinsic muscles. And they are associated with movements of the wrist joint. They are associated with the flexions of fingers, including the thumb, and they are also associated with the pronation. Even though pronation is actually occurring at the proximal and distal radioulnar joints, and they are actually movements of the forearm, but still their movement actually influences the orientation of the hand. So that's why it was important to mention it here. But still, we are going to talk more about the functions which are much more related and occurring at the level of the joints of the wrist and the joints of the hand, including thumbs and fingers, etc. So talking about the superficial layer, we have the flexor carpi ulnaris, palmaris longus, and flexor carpi radialis. And these three muscles have an origin or a common origin from the medial epicondyle of the humerus, and thus that site of origin is known as the common flexor origin, because it is clinically very important and significant as well, and it is commonly involved in condition known as medial epicondylitis or golfer's elbow as well. And they extend distally from forearm into the hand, and they perform their functions at the level of the wrist and the hand. Most commonly is the flexion of the wrist. Now, if we take a look at the name of these muscles, so we have the ulnaris, the longus, and the radialis. So ulnaris means that towards the ulna or towards the medial side, and radialis means towards the radius or towards the lateral side. So even though all of them arise from the medial side, which is the medial epicondyle, but the radialis moves more laterally. So here we can see that the muscle which is on the most medial aspect is the flexor carpi ulnaris. The one in the center is the palmaris longus, and the one on the lateral side is the flexor carpi radialis. Then there is another muscle which is even more lateral to the flexor carpi radialis, and that is the pronator teres. But pronator teres is mentioned separately because it has a different origin site as compared to the flexor carpi ulnaris, palmaris longus, and flexor carpi radialis. So we can again see these muscles here, and we are going to take a look at them in detail one by one now. So starting off with the flexor carpi ulnaris. So talking about the flexor carpi ulnaris, the origin is from the medial epicondyle of the humerus, as we already mentioned, the common flexor origin, and the insertion is to the pisiform and base of the fifth metacarpals, because this muscle is located on the medial aspect. The attachment is, or the action is the wrist flexion and ulnar deviation. Because this is a flexor, so obviously wrist flexion is a function of it, but ulnar deviation because it is present laterally or towards the ulna, so shortening of this muscle would cause ulnar deviation. Similarly, when you talk about flexor carpi radialis, it would also cause flexion, but radialis means it on the lateral side, so it would cause wrist flexion with radial deviation. Moreover, the origin is the same between the flexor carpal radialis and flexor carpal ulnaris, which is the common flexor origin site, which is the medial epicondyle of the humerus. The only difference is in the terms of the insertion, which is more laterally located for the flexor carpal radialis, and that is on the base of the second and third metacarpals. Another difference is between the nerve supply. So the nerve supply of the flexor carpal ulnaris by the ulnar nerve and the nerve roots C8 and T1, and whereas for the flexor carpal radialis it is median nerve with nerve roots C6 and C7. Now the muscle which is located between the two, and it is actually in the center, so it does not cause any radial deviation or ulnar deviation, and it just causes wrist flexion, is the palmaris longus. The origin is once again the same, which is the medial epicondyle of the humerus, but the attachment or insertion is into the palmar fascia or the palmar aponeurosis. The nerve supply is by the median nerve and nerve roots C6 and C7. Now, after talking about the superficial layer, let's talk about the intermediate layer. And in the intermediate layer, we have the muscle which is known as the flexor digitorum superficialis muscle. So this muscle, not only as the name suggests, that flexor digitorum, so it not only flexes or helps in the flexion at the wrist, but its major function is at the level of the digit. So it is involved in the flexion of the metacarpophalangeal joint as well as the proximal interphalangeal joints of the fingers, and the nerve supply is one again by the median nerve, but the nerve roots are slightly different, which is C7, C8 and T1. So the origin is by the common flexor tendon, but also from the chronoid process and the radius, and the insertion is the sides of the middle phalanx or the four fingers, because as we can see that the insertion is more distally, so we can see that the function is also more distally, which is at the level of the metacarpophalangeal joints as well as the proximal interphalangeal joint. It does not act on the distal interphalangeal joint because its insertion is at the level of the middle phalanx and it is not reaching the distal phalanx, so it cannot cause the action at the distal interphalangeal joint. Now talking about the deep layer of the muscles, so in the deep layer we have the flexor digitorum profundus, we have the flexor pollicis longus, and we have the pronator quadratus. So flexor digitorum profundus, once again just like the flexor digitorum superficialis, but the name is profundus, which means the superficialis is superficial and profundus is deep, and the nerve supply is the same, which is the median nerve, but also it is also supplied by the ulnar nerve, and the nerve roots include C8 and T1. Talking about the origin, it is upper 3/4 of the ulna, so it is not crossing the you can say the elbow joint or the humeral or the humeroradial joint, and the insertion is on the distal phalanx of the four fingers, so this can actually flex the distal interphalangeal joints as well, unlike the flexor digitorum superficialis. So the function is at the level of the proximal interphalangeal, distal interphalangeal as well as the metacarpophalangeal joints. Now talking about the flexor pollicis longus muscle, so flexor means obviously it's a flexor, but talking about the pollicis, which means it acts at the thumb, and the origin is from the radius, the anterior surface of the radius, and its insertion is the distal phalanx of the thumb, and the function is it flexes all the three joints of the thumb, so which means the function is actually similar to the flexor digitorum profundus, but profundus only acts on the second to fifth digit, so for the first digit there is the flexor pollicis longus serving the same function as the flexor digitorum profundus, and the nerve supply is by the median nerve, and the nerve roots include C8 and T1. So that was all about the extrinsic muscles of the wrist and hand. I hope you learned something new out of it, and keep on watching sqadia.com for more lectures like this. Thank you very much.